over the phone to help answer some more of our coronavirus questions, Dr. Christie Alexander from the FSU College of Medicine. Dr. Alexander, as we always start these sessions with, how are you holding up right now?
Hey there. Good to hear you guys. I am holding up okay. It has been, you see the numbers going up. I walked into our clinic on Monday. Everybody's wearing masks all across the board now. The entire staff, everyone. So it's definitely become a lot more real for us here in Leon County.
And Dr. Alexander, on that note, since we last spoke, the CDC changed its guidelines recommending that everyone wear a mask in public. A lot of folks making their own. I'm one of those people. What do I need to do to make sure at the bare minimum my mask is safe?
So great question. And you're right. The CDC has come out with the new guidelines again, because as I said on our Friday segment, we're building this boat as we sail it. The more we learn, the more we know. And we're finding that the use of cloth face coverings is actually helpful. Because as we know now, there are a lot of people that are asymptomatic or pre-symptomatic that haven't yet developed symptoms that can still be transmitting the virus to others. So if you come into close contact with somebody who's asymptomatic or pre-symptomatic and they cough, sneeze, or even talk too closely to you, they could spread it to you unknowingly. So these face coverings, these cloth face coverings will protect that from happening, particularly if you have to go out in public, go to the grocery store, go to the pharmacy, something like that. So anything that you can use, they're even saying scarves, bandanas, folding them in half, wrapping a hair tie around both ends and tucking the ends in the middle and putting it over your ears. Anything at all, even that will protect you from transmission if you were to come into contact with somebody who's asymptomatic or pre-symptomatic.
Yeah, Katie made some for us over the weekend, and I don't think she has any hair ties left, but they got the job done at least.
Yeah. That's fantastic.
Right? You do what you have to. The latest numbers show, Dr. Alexander, that we're at 71 confirmed cases here in Leon County. Does that tell you that we're definitely seeing some sort of community spread?
I believe that it does. Just 1 week ago, we've more than doubled in cases since last Wednesday, if that tells you anything. And I know 71 doesn't sound like a big number, but when you're more than doubling within a week, that's pretty significant. So we are now in that hotter zone. I mean, we're not like Orlando or Miami, of course, but this is that point where we're seeing community spread in our own communities now.
Okay, in Tallahassee, Memorial Healthcare just put out a message saying there's the potential for a big surge with several hundred hospital admissions each day in our area. Do you think that's possible, and can the region's healthcare facilities handle all that?
I do indeed think it's possible, and I do think that our area hospitals and centers can handle it. I know that our hospitals have been gearing up for this. We've seen it coming. We knew it was happening in South Florida. And, for example, TMH has already started to change some of their old post-surgical suites and older surgical centers into isolated COVID areas should we see that boom happen. So we're already making measures. We're already making sure that we can do something should it happen. So I think we will be well prepared.
Today we learned an employee at a Tallahassee Publix tested positive. We've asked several times when we've had you on, does the virus live on certain symptoms surfaces, and how long they might live on them for? Do we know, is the virus capable of spreading on fresh foods like fruits and veggies, or on food packaging?
So first off, I have to say it just breaks my heart because these essential workers have to go to work, right? So, I mean, our essential workers are going to start getting sick, and it's just heartbreaking. To your question, though, the fruits and vegetables and the things that we're buying in the grocery stores, so we've known for a long time that viruses can be on the surfaces of fruits and vegetables, and the CDC has been saying for years, make sure you wash or scrub your fruits and vegetables under running water, even if you don't plan on eating the peel. So this is certainly true in this setting as well. Make sure if you are buying fruits and vegetables that you clean them thoroughly, and then wash your hands immediately thereafter. Cut away any of the damaged areas, bruised areas, things like that, and dry your fruits and vegetables with a clean paper towel.
Okay. And we're also seeing models projecting a peak in the next few weeks in Florida and in Georgia. What do you think about that timeline? Does that seem to be about right?
It sounds about right to me. I've been following the models as well, and just seeing what's happened in other areas where it takes a couple, you start to see a few cases, and then within 2 weeks, you see that big peak. I mean, we're basing that off of what's happened in New York, in Louisiana, down south, overseas. So based on what we know, it does seem accurate to me.
The governor said yesterday that 1 million doses of the malaria drug hydroxychloroquine were arriving. They were supposed to arrive in Florida today. What are your thoughts on its potential effectiveness fighting COVID-19?
Well, as of just yesterday, the CDC stated that there is still no drugs or other therapeutics approved by the U.S. Food and Drug Administration to prevent or treat COVID-19. While all of these drugs are under investigation, including the malaria drugs, hydroxychloroquine and chloroquine, they're definitely being tested. They're not without their side effects. And as I think I mentioned prior, one of the biggest ones is that that particular drug can cause an arrhythmia that can lead to cardiac arrest and sudden death. So to use it out in the public, just generally speaking, is not a good idea. If they're using it in the hospital on somebody that's on a monitored bed, like hooked up to cardiac monitoring, that might be okay. But again, nothing yet has been proven to be effective.
Gosh, Dr. Alexander, we do appreciate your insight. Before we let you go, is there anything else that you would like to add?
I would just like to thank everybody at WCTV for giving me this opportunity to share all of this information with your viewers. I really do appreciate it. We have a saying at the College of Medicine that teamwork makes the dream work, and I very much appreciate being part of your team for this.
Well, we thank you so much for the knowledge. We know it's helped a lot of people out there.
Absolutely.
And like you touched on, I mean, the public's employee, a frontline worker right now, we obviously feel for them. And our medical professionals like you out there doing what you're doing day in, day out. Thank you so much. And we'll, I guess, talk again on Friday.
Excellent. Thank you, guys. Have a great day.
You too.
Okay, Dr. Alexander will be joining us again on Friday, as Ben just mentioned, to answer some more of your questions. And as always, you can rewatch this interview and our previous ones online at WCTV.tv.